All right, all right, all right. Hello, everyone. Hey, Dr. Claire, how you doing?
Hey, I'm great. How are you?
Doing wonderful. Happy to be here. Thank you for joining me. I appreciate it.
It's a
And we are
pleasure.
live. And we are live. So, my name is Kafri J, founder of Hip Hop for the Future, and a myriad of other organizations here in the Bay Area working on hip hop activism and organizing our community. Dr. Claire Green-Forde, the indomitable, amazing person that helps me rock and legitimize my work, if I can say so. I'll let you introduce yourself.
Your work is already legitimate and it is incredible and powerful. And thank you so much for joining us, everyone. And thank you for giving me the platform to share space with you. You're an incredible human being. And I will tell you that publicly and privately. So, I am Dr. Claire Green-Forde. I am an unapologetic humanist and intersectional mental health practitioner, racial and social justice warrior, advocate, thought leader, and practitioner. I am truly honored to be here. And I'm really excited for us to kick off Mental Health Awareness Month by talking about the healing power of hip hop and hip hop as an organizing tool for public health, for wellness, for justice, and for community well being.
Awesome. It looks like I cannot see the LinkedIn comments, unfortunately.
No
Oh,
worries. We got text, so we're on all the texts.
text word. Looks like we've got a few people on board right now. Looks like somebody related to's on board.
Oh, I see Anthony.
Yeah.
Hey, Anthony.
Yo. Awesome. Oh, Mr. Pineda. Yo, that's the homie right there. Awesome. I just appreciate this because I've been trying to figure out what I wanted to do with my life. As of recent, I've been a very disaffected voter. I'll say that. And so about a year ago, I made a choice to actually. Oh, is that those are the comments? There we go.
Yeah, they're popping up now.
Yay! I made a point to actually go for what I know will work, and that's just trying to make individual people in my community live longer. Trying to make hip hop that connective tissue that can, bridge the gap between services and folks that need services. So it's been an interesting journey that I found myself in, and that's everything that I'm doing with Hip Hop for the Future. Just trying to make sure there is an actual future for people that look like us.
Absolutely.
For real.
Absolutely. We need it. And it is certainly scary what's going on right now. So I totally get it. It's scary. And I think that as we bring people together for this series and over the next few weeks, we want to also make sure that you know that we care about your well-being as well. There are going to be things and topics that we talk about that could be activating for you. If you need to step away, if you need to scream, scream. If you need to cuss, cuss. If you need to jump up and down, do that. Whatever those things are to support your well-being, because we're here for all of the things and all of the ways that make you feel the most human. We are truly grounded and centered in bringing the humanity back to the way that our people are treated, are seen in our society. And I think that it is so important that you know that your humanity is valued here. We see you because we are you.
Real talk. Real talk.
Yeah.
I am a humble dude from the streets of Hunters Point, San Francisco, Third and Palouse. We come from these places, so I'm just really happy to be able to do this series. I reached out to Dr. Claire, and I was like, "Yo, how do I get this out to the people?" And I really appreciate your concept of doing this 3-part series, especially during May, Mental Health Month. You know what I'm saying? After coming from Women's Month, you know what I'm saying? I think a lot of us have been focused on the health and wellness of our people. So this is really timely. I'll say that.
Absolutely. And coming right off of April, right, is Stress Awareness Month and also National Minority Health Month. And so we know that hip hop is a culture and we know the people that are impacted, and it's a global phenomenon, right? So let's just be clear, hip hop is not just one demographic of people, but hip hop is a movement. And we're going to be talking about hip hop as a movement over the next 3 weeks. We're going to be talking about hip hop as an intervention for addressing health and wellness. And we're going to be talking about hip hop as a culturally honoring, celebratory aspect that we should all be doing. I'm an island girl, right? So you're from Cali, I'm from Barbados. So all my island massive booked up. I am. The reality is that we know that music and culture is who we are and what makes us. And so we want you to have fun. We want you to ask questions. We want us to have real and honest conversations. And I'm going to kick off by asking you to talk about, why are we here? Like, how did we even get here? You talked a little bit about it, but why are we discussing this? And why are you taking this approach to using hip hop to address mental health as a public health intervention?
Word. Well, I definitely didn't start with mental health. You know what I'm saying? I'm not a health. Well, I am a health professional now because I own that. I'm claiming it. That's mine. I'm gonna stop saying I'm not. You know what I'm saying? Because I've been doing a lot. But I started this thing called Drip Fest. I work with an amazing partner, Francesca Gonzalez, out here. She's the director of Green-Forde. They're an anti-trafficking organization out here that's trying to put resources in the hands of folks that are in disparate situations that might lead to trafficking. And so we kind of got together. I've been throwing hip hop shows and free events rooted in social justice change for a long time. And we kind of wanted to think about having a back to school event. But kids don't really need backpacks and school supplies if they don't have like clothes and mental health and health care and a doctor, you know what I'm saying? So we created this concept called Drip Fest, short for dropping resources in place. You know, if these folks don't know how to go get the resources or where, let's bring the resources to their hood. Let's surround it with hip hop. Let's make it fun. Matter of fact, I got a really cool video. We just got this video from the last Drip Fest where we had Yo-Yo. So if I could just throw this on the screen.
Drop the video.
I'm so excited about this video. Check it out, y'all. Here it goes. Let's see.
Oh man, I'm honored to be over here in the Western Addition side of San Francisco, where I was born and raised. Over here at the African American Cultural Center at the Drip Fest. You know what I'm talking about? You know, just putting on for the people.
So we had over 15 nonprofit organizations come through, lined up, providing services and resources. We also had Umoja Health come through, doing vaccinations, health screenings, and other health resources.
You want to see how she does it? Watch. 1, 2, 3. Word. Shout out to Umoja Health. I'm about to get my COVID booster, my flu shot, get up to date. My daughter said she's willing to get hers as well. She's being strong, so health is wealth. I think we're trying to reimagine the healthcare ecosystem and how we really do outreach to communities of color. And I think hip-hop's the best way to do that.
I think we've come to a time where community, hip-hop, health, wealth, and all of that stuff is really at the forefront. So we just want to let everybody know we're all thinking about it. We're all concerned. We all have a lot on our plate, but it matters.
All right. So that is Drip Fest. That's our first really good teaser video. But that's just the thing, you know, hip hop is the strongest organizing tool that we have. So it just makes sense to use that to organize around different issues. And because, you know, after we lost Roe versus Wade, I was like, yo, I don't know what if white folks can't say, if white women particularly cannot say Roe versus Wade, I'm not too sure what the local trans black woman's going to do in San Francisco. Like, we don't have those rights. We don't have that political power. So I kind of shifted from going into, you know, trying to fight climate change and trying to get, you know, the biggest bulk of political power, which is, you know, white voters in the Bay Area, to actually care. Because if you look into the statistics, when I was born, black people were 13% of the population. Now we're 5% here in the Bay Area, San Francisco specifically, but we're 38% of the unhoused. So this is the root of me being like, I'm out. I'm just working towards health and making sure people can live long because I don't know what else to do. And so that's kind of like this idea of Drip Fest, where we use hip hop as this organizing tool, make a huge free show that's all ages. If my daughter can't come, I don't throw it. You know what I'm saying? And then we bring a bunch of healthcare orgs that are having a hard time doing outreach. A lot of these local organizations, like local doula services, Emoji Health, they might not know how to throw a fat hip hop show like I do. So I think hip hop is that connective bridge. And at the last Drip Fest, or the second to last one, I was approached by the San Francisco Department of Public Health. And they were really interested in hip hop as a means of therapy, of making things more culturally relevant, you know what I'm saying? Safer. And I was like, yo, I that's what I do. I've been an educator for so long. I was like, yeah, let me dig into this. And shout out to the homie, the SF legend, Huey MC, who works at the SF Department of Public Health, for creating that connection. Remember, it's always people in our community that put us on, the gatekeepers, as we speak to, right? So Huey opened the gates. I created this workshop, Hip Hop Therapy 101. And it's really just an introduction to hip hop therapy as a concept. And I went in there, and mind you, this wasn't just a bunch of white folks or anything like this. This was a really diverse group of people at this facility. And after I did this curriculum for them, this presentation, I was taken aback by how much it resonated with them, how much that they didn't even know this existed. And for me, I've been a hustler all my life. If I see demand, I can get a supply. You know what I'm saying? And now, especially within something as important as creating safe spaces for Black folks like me to be able to be vulnerable, I'm like, yo, if we don't need that right now, you know what I'm saying? If the hood doesn't need a good, comfortable space to vent, to release, to deal with these feelings, I don't know what we need. So, I created that workshop. I went and changed my whole website. Like, yo, we offer this now. I've done the workshop for international mental health organizations. I've been invited to speak at 2 different conferences about this. And hip hop culture is something I know. Just to make it short, I've been teaching for 20 years. I started a pedagogy that taught 32,000 kids. I taught 8,000 myself, but during that frame, I couldn't write a grant and say I was a hip hop therapist, even though I know I've helped some of these kids out probably more than the school counselors. But that's how I got in it. And yeah, I'm just inspired.
I mean, I love it. And I hear Lewis says no one throws a party like you. So I'm just saying, like, where the party at? Yo. So I think that something that you said in the video is literally the foundation of why we're doing this. This is about reimagining the healthcare ecosystem, right? As a healthcare provider, I can tell you that the way that we're trained, our diagnostic criteria, the way that we are educated, the way that we practice is not always rooted in cultural responsive care. It's not always rooted in culturally celebratory care. We say the things, but we don't do the things, right? The regulatory bodies, the entities, the way that we are required to maintain our licenses doesn't always align, right? There's no such thing to me as cultural competence. You can't be competent in anyone's culture, but we can certainly be culturally celebratory. We can certainly be culturally humble. We can certainly be culturally responsive. And we can certainly be culturally curious. And so this discussion is about your curiosity, all of you. So we want to see your questions. We do want to make sure that we do note, though, however, nothing that we say here constitutes as medical and or clinical advice. This is information that we're sharing, general information. But as we start with Mental Health Month, I just want to give you a few stats, right? Like 1 in 5 people in America have a mental health need, at least 1 in 5. And we say at least because we know that so many things are undercounted. 1 in 6 children at least has a mental health diagnosis. Children. We know that suicidality among Black girls, Black boys, Native girls, Native boys, Hispanic girls, and everyone has been increasing significantly. And it is terrifying. Because if we don't care about the health and well-being of our children, we don't have a future. So when we talk about hip hop for the future, we're talking about our kids. We're talking about the generations. And if we don't heal the trauma that we carry that is not transformed will be transferred to the next generation, the next generation, the next generation. This is about interrupting cycles of violence. This is about interrupting cycles of oppression. But this is also about lifting up healing. This is about lifting up practices that are honoring. We have hip hop. We celebrated 50 years of hip hop last year. If we have 50 years of evidence to tell us about the intervention of hip hop as a global tool in addressing things, in movements, in shaping movements, there are courses being taught in universities and graduate schools about hip hop. There are courses that are using the lyrics from Tupac to discuss, and we're going to talk about Tupac too, because Tupac talked about mental health, right? We're going to talk about artists that are currently talking about mental health in their songs. And we're also going to talk about some of the big biases and stigmas that continue to perpetuate this idea that hip hop is violent, that hip hop is misogynistic. Are there aspects of that in all kinds of music? Absolutely. But hip hop is not only music. And I learned that because the incredible professor over here taught me that there's 10 elements of hip hop. So I'm already learning so much and I love it. And so if you guys see on the bottom, health and wellness is one of the 10 elements of hip hop. This is why we're having this conversation. So I want you to start with laying the foundation for us of how do we get to the 10 elements? Where did hip hop come from? What is this thing?
Well, so this is something that, you know, we have the whole 50-year anniversary, right? That is the anniversary of a party, one party, 1528 Sedgwick Avenue, Cool Herc. There's a flyer, you know what I'm saying? 25 cents for girls, 50 cents for boys. It was the first time he showed the merry-go-round technique that eventually led to beat juggling and whatnot. That can be considered the first hip hop party, but these practices are old as time immemorial. Like hip hop is a part of an unbroken chain of Black expression and the ways that we've expressed ourselves since before we have recorded history. So I think hip hop started before time, you know what I'm saying? But it's been solidified from that party on in the culture, starting in Bronx, New York. Hip hop took over. And I like to tell people right now, hip hop is the largest human expressive form that has ever been invented. Period, point blank, full stop. These are shared practices that we have that have defined how we roll since I don't know. You look at Cab Calloway, right? You know what I'm saying? He's over there doing some moves we can see on the break floors today. You know what I'm saying? If we look at Pigmeat Markham, he was rapping his behind off. You know what I'm saying? The Jubilees back in the 40s that were rapping about old Noah. Oh no, like they're spitting rhymes. Now you might not be able to call that hip hop, you know what I'm saying? Because it might not have been to that beat break, you know what I'm saying, that came from one of James Brown's drummers. That's one of the most sampled drums loops ever. But hip hop was ordained as a culture by the Universal Zulu Nation. And a lot of people don't think of it as a culture. They mix up hip hop with rap. Rap is just an oral form coming from hip hop culture. So I'd like to set that down. Hip hop is a culture pure of shared practices. We've got the beatboxing, the MCing, DJing, graffiti, breaking. A lot of people really understand that. But if we look at the message, you know what I'm saying? One of the first rap video out there, and we could talk about its content, but you have these people having pure knowledge of self, understanding who they are and how they fit into their environment, right? They're talking in their language. They're not code switching, right? They're speaking like them. And hip hop has its own language. It has its own grammar patterns. And if you come in there trying to fake the funk using hip hop words or hip hop phrases out of grammatical structure, you will be called out instantly. We have our own fashion, our own styles. And, back in New York, they used to say you can tell what borough somebody was from by what style they wore, you know what I'm saying? And we also have our own kind of hustle. And I don't want people to go to the negative in that, but people sell their incense on the corner. They sell their tapes. They sell their clothes. Dapper Dan had his street hustle. You know what I'm saying? And he didn't necessarily get to work with Gucci until very recently. You know what I'm saying? So the way he had to sell his wares wasn't the normal way that Macy's sells their wares. It was his own type of fashion hustle. And because we've been excluded from the primary economy, we've had to form our own fashions and our own means and methods of hustling. And shout out to Hip Hop is Green for their work in making the health and wellness the 10th element of hip hop. Because, I mean, we come from certain communities. Part of our health and wellness is songs like The Message, where you just say, we're going through it. I'm close to the edge. Don't push me. Talking about that kind of health. Using hip hop practices like the festival, the street party, you know what I'm saying, to get people organized around things. These are all ways in which hip hop culture thrives. We celebrates what we do. So, yeah.
Loving it. And I mean, masterclass. And yeah, somebody like the professor. Absolutely, Lewis, the professor. Because when we think about it, right, like we are talking about a culture that has been for years, decades, addressing social injustice, poverty, crime. You know, I learned about the connection with the Vietnam War and what was happening, right? And you're in California, I'm in New York. We got West Coast, East Coast love. We love, right? We're bringing it together. We love. And so because we love people, we love justice, we love organizing. We wanted to make sure that we were really having a raw conversation. So this is going to be the conversation that we're having with you, but we want to make sure that you're also engaged. So you just dropped some of the lyrics. I was going to ask them to put those lyrics in. Who knows the lyrics? who can, don't push me. What's the rest of the lyrics? You know, because when we're looking at that was in 1982. So we are talking about 42 years ago. And if you're close to the edge, I'm about to lose, like, I'm losing it. Yeah. But why? Why are we losing it? Because of the poverty, because of the crime, because of the police brutality, because of the injustice, because of the educational system, because of the school to prison pathway that continues to be reinforced, because of the carceral system that is damaging our communities, because of the war on drugs that really wasn't a war on drugs, it was a war on people, right? All of these things, because of what's currently happening in this world right now, where people are being killed and dying every single day. How does that impact our mental health and well-being? So when we think about hip hop, to the point you made, this is not just rap. And so many people have that misconception. And I did too. I'm like, the music, and I could see the art and all of these things. But when you look at it as a broader thing with all these components, that's truly a culture. So how do we use culture to shift the narrative of what's happening in society? That's to you.
Well, you know, I gotta highlight this comment right here because it's really important to get this. You know what I'm saying? I think straight up, and I think this is one of the biggest things that I take issue with, you know what I'm saying, is because we have to define culture versus media, industry, music biz, because that's two different things. And I think one thing that we have to realize is the music industry has never been FUBU. The music, and for those that don't know, FUBU, for us, by us, the music industry was never by us. That's why they were able to take rock and roll, and now Elvis is the king of rock, right? You know what I'm saying? Same thing that happened with hip hop. So if we look and view our culture through these white media industries, it's going to look different. And at one point in time, you know, I think the industry didn't really understand how to use hip hop. They had to come ask us who was the dope rapper, who was the leader. And so at one point in time, we controlled who was the least dope. That's why you had a Tribe Called Quest, as well as the Schoolie D, as well as the Houdini, as well as the MC Lyte and the Queen Latifah. But they have figured that out, hook, line, and sinker. I was just talking to somebody about Drake and the fact that a lot of people are writing raps by committee now, where Drake is in the room with 20 other people, and they have an agenda of what they want to create with his next album. He wouldn't be sitting in there with Lucian Grange like that. Yeah, committee. I learned that from Ice Cube. So industries, if I'm gonna put $500 million behind marketing this stuff, like I need to make sure every word you say is appropriate for our agenda. And that's why we don't have philanthropists like Tribe Called Quest. We have philanthropists like Jay-Z. And that's a whole nother conversation. But what I speak to is the fact that hip hop on the ground is a culture, and that culture has to be facilitated by people who embody that culture. For me, it's like I can be mad at iHeart for taking over my local radio station, or I could rock with my local KPOO San Francisco 89.5 FM, the oldest Black-owned station west of the Mississippi, and then provide the alternative. You know what I'm saying? Because if we're not investing in our local hip-hop scene, then we must be quiet about it. You know what I'm saying? What the industry is doing. We have to be investing in that. So, you know, it is terrible what the industry is doing, but they're doing what they're going to do. And that's something that a lot of people don't know. Right now, 3 corporations own 90% of the means of producing the rap music, not the breaking, not the graffiti, you know what I'm saying, but the rap music that our kids are feeding into. Not only that, about 70% of the music is being bought by suburban college-age white men. You know what I'm saying? White men. And people are like, well, why? Why is it so misogynistic? Well, you think white men are going to be trying to listen to angry Black women rapping about their socioeconomic status and their mental state? I you know, posit that they probably won't want to spend their $20 on that CD. You know what I'm saying? You know, they probably want something that's a little bit more palatable for them, and that's what we get. You know what I'm saying? And that doesn't mean that rap is a bad thing. That doesn't mean that hip hop has gone astray. That means that we are finding it harder and harder to get access to our culture because the dollars of suburban white men. And there's no way that we have enough economic power to battle against that. It just isn't. So a lot of people have asked me in the past, are you trying to change the industry? No, I'm not trying to spin my wheels and go any more crazy than I feel already. You know what I'm saying? But what I am trying to do is to elevate my own community, get my local community artists paid, because hip hop, if anything, hip hop is local. Right? Hip hop is local. It's when I walk outside. It's when I'm putting on my clothes. It's when I'm going to see my local homie rocking at a local show. And if we're not going to these local shows, paying our $10, $15 to see this local female identified artist rapping about liberation of our women, then why are we getting mad at WAP? And, you know, I just don't, you know, I don't even understand that. So if we got to be supporting our local hip hop, we got to be on the ground. We cannot just get mad at white media as if they're supposed to be the bearers of this Black culture. So
Facts. I mean, absolutely. No one's going to tell your story but you, because that proverb, if the hunter is the one telling the story, the hunter will always be the victor in that story. But if the lion tells that story, it's very different, right? And so I think we have to understand how all of these things connect to our own self-identity, which is so deeply connected to our sense of worth, our mental health, our image. Dr. Joy DeGruy in Post-Traumatic Slave Syndrome talks about vacant esteem and this concept that we don't even have this sense of who we are. This has been robbed and stripped from us, right? And so think of what that does to you. I can guarantee that every single person on this live right now has experienced discrimination in some form. I can guarantee that you have experienced hurt in some form. I can guarantee that you have experienced being othered and ostracized and injustices done against you based on all the intersecting identities that you carry. Every single human being has an intersecting identity. Every single person. Because no two people are the same. Shout out to my twin sister who was on this live, Charmaine. We are twins. Totally different identities and experiences, even if we grew up together, right? Even if we share DNA, even if I sometimes borrow her shoes and forget to give them back. But that's a different story for a different day. Well, ultimately, we have to recognize, I mean, that's what sisters are for. I mean, come on, closet, you got 2 closets if you got a sister, come on. But ultimately, all of these things lead to us not knowing who we are. So when you think about hip hop and why culturally and structurally these things are being taken from our community, we cannot let the people know who they are, because God, if they knew who they are, they would have their power. This would completely flip things upside down. And so you have to think of things much deeper. When we think of it as a public health intervention, as an organizing tool, people organized, you know, when I go back to the Black Panther Party, right? People are organizing to bring community resources, right? Organizing against injustice. If they could carry weapons, we can carry weapons too, to protect our people. But we're not going to just do that. We're bringing school lunches, we're bringing resources, we're bringing connections. But that had to be dismantled. Why? Because people were getting too much power. We look at all these movements in our society. We look at all the social factors that continue to contribute to the dis-ease in our minds, in our bodies, in our souls, in our spirits, and in our communities. And we have to wonder, Why are the same zip codes from 60, 70 years ago the same zip codes today that had the highest poverty rates, the highest illness rates, the lowest rates for graduation from schools, the least representation from their elected officials? Why are those the same zip codes? Those are also the same zip codes that have really poor hospital and healthcare. Really.
Yeah.
I can tell you in New York right now, the same zip codes that have been around forever. I can tell you in New York City, the same zip codes that had the highest COVID deaths are the same zip codes that for years have had lowest attainment. They've had poor sanitation services. They have a liquor store on every corner, but God forbid they have a library. Those are the same communities.
Yeah.
It is our responsibility. As I said, I'm an intersectional mental health practitioner. I cannot separate social and racial injustice from the mental dis-ease of our communities. And I'm also a public health practitioner. This is health. When we think about the health and well-being of our people and multiple people, this is about people all across the world. Of course, our focus is on people of the global majority because that is who is dealing with the brunt of the social and racial violence that is existing. But we also think of the impact. When we talk about hip hop for the future, we're literally talking about shifting the dial, because epigenetically we pass on depression, we pass on these things. There's a reason why there's a link between maternal depression and child depression. If you're experiencing stress and anxiety when you're carrying a child, people who can give birth and women who are carrying, their stress is passed on. We're changing genetic coding and things are being activated and deactivated in our DNA. We're talking about an epigenetic approach to this system that we live in, because we have to interrupt and we do have to shift the narrative on the way that we're providing care and understanding how we use culture as a form of intervention and healing. And so I would love for you to go into a little bit more and elaborate on how hip hop has traditionally been used as a voice for the marginalized. And the second part of that is, how can hip hop provide accessible spaces for people to express their vulnerability and to begin to heal?
I mean, so for me, I remember when I was a young toxic man, you know, 15, 16, falling into trying to find my power and falling into the normal hood trappings of a kid growing up in the 90s in the hood, you know what I'm saying, listening to DMX too much. I remember being very hurt. I was hurt, and I had no language for it. But I do remember when I first learned to rap. And there's a farmer's market out here called the Alamany Farmer's Market, and it's just this big, wide parking lot with stalls. And at nighttime, there's just a bunch of trucks parked there, and you can yell and scream and nobody really hear you. I remember being on top of those trucks at night, and that was my stage. I was like just learning how to rap, and I remember pretending that I was in front of thousands of people and I'm rapping, you know what I'm saying? And what I was rapping about, it might not have been the most positive stuff, but it was affirmative, you know what I'm saying? Like hip hop and rapping in general it's like centered around practicing self-affirmation. You know what I'm saying? For good, bad, whatever you think it is, you are trying to affirm your worth. And a lot of like behavioral therapy is just practicing, just thinking certain ways or acting certain ways and just getting those neural connections myelinated or whatnot so they can just pop up more readily in your head. And unbeknownst to me, I was literally convincing myself that I was the ish, you know what I'm saying? And that's why I always say teaching kids how to do hip hop without teaching them the history is kind of like handing a loaded gun to somebody without teaching them how to use it. It's very dangerous because kids will affirm themselves. But I think that's what hip hop has always been, because in those zip codes that are the most marginalized, that's where hip hop is the loudest. You know what I'm saying? If you don't give me art in school, as Black kids have 50% less access to art classes. If you don't give me art classes and I'm Basquiat, well, your Home Depot's not safe. You know what I'm saying? I'm going to get me some spray cans and I will paint my rage on your city. And that's just it. If you don't give me the art class with the easel and the figure drawings and whatnot, like all these white kids and these other zip codes have, then you're going to have graffiti painted everywhere. And a lot of that graffiti will be political in nature and will talk smack about the city. It's just how it is. It's how it's always been with expressive forms coming from diasporic communities, right? And it's either affirming our struggle or affirming our identities. You know what I'm saying? And through those practices, we find ways to come together. It is literally that. It is the embodiment of people trying to come together, build community, and trying to feel like they're worth something regardless. You know what I'm saying? So another thing is, you know, a lot of people, when they think of rap, they're like, oh, well, you know, a lot of that stuff's negative. No, actually, where I'm from, if you look at the women rappers in the Bay Area, there's a few of them that rap like Cardi B, but most of them rap like Nina Simone. You know what I'm saying? Most of the available shows are those type of people rapping. And it's only been a struggle to get people there, because once you get there, that you're in the audience, you're like, yeah, I feel the same way. Oh my goodness, wow. You know, you see these young women and men looking up to these griots, these storytellers, and seeing themselves in them, seeing somebody who's been through something very similar. It just makes so much sense. So these shared practices, these shared schema, these patterns, you know, speaking about the brutality that you're experiencing. I got beat up at gunpoint twice by the SFPD before I was 17. I don't know what happened when you got your first paycheck with 3 of your friends that were trying to act good and then went to the bank at the same time to cash them because y'all was going to buy video games at 15. But yeah, I know what happened to me. You know what I'm saying? And I don't think I was able to process that ever. But I was able to process my rage through a lot of the songs, and through hip hop, I came to this point of not wanting to be a gangbanger anymore. When I heard Black on Both Sides, Most Def, and the Hieroglyphics crew, and I started hearing all these, I was like, oh snap! You mean I don't have to rap about money? You mean I don't have to be toxic and talk about treating women badly? And I can still find my power through my own cultural identity and my ancestors? Wow. Those drums, and I say it all the time, when you hear your ancestral drums beat for the first time in your head, you will never unhear them. You know what I'm saying? And that's what hip hop can do. It can really validate who you are. And there's so many ways to do that. Whether you are the cat on the corner who feels this way, or the cat who's trying to go into the collegiate space this way, there's a rap for you. And it's that it just makes sense to me. It just made so much sense, and it's ubiquitous to hear hip hop saved my life. It literally saved my life.
Powerful, beautiful, raw. Thank you so much. Like, you said so many different things that I want to pull out, right? So you mentioned like DMX. And I think of DMX as someone who lived with such severe mental health needs, right? So I think back to that Great Depression album, right? Where it's like, how much more clear can we be about what's happening? And that was before mental health was trending, because that's 23 years ago, right?
Mm-hmm.
And we think of someone who tortured soul essentially in many ways, but yet gave so much.
Yeah, I'm
and
slipping.
I will say though, because I know that, pardon?
I'm slipping, I'm falling, I can't get up.
I mean, literally, right? And that goes back to the message, right? If those same lyrics that I'm about to lose my head, like I don't, like, literally. And so when we think about these lyrics, I also want to be clear though, because I know sometimes, even for myself, like I will not listen to a lot of music that has a lot of cursing and all that stuff in it, because I'm just like, no. But I have to also recognize that that is also a form of linguistic expression. And we have policed, because we have whitewashed and we have made what has to be PC. But if we could take away that instant reaction to police that, right? What we see in between those lines are people's pain, are people's trauma, are people's triumphs. When we think Tupac, oh my gosh, like from the social justice things that he was talking about. Brenda Has a Baby. I know we had talked about that, right? Like, what? So many tears. So many tears. If that is not a foundation of like, I am struggling. And but also reflecting what the struggles are around him. So when we think about the rap form or the musical form, one component of the 10 components of hip hop, it is not all of hip hop. So we ourselves have to educate ourselves that the musical expression that we know as rap is a form of hip hop. It is not the totality of hip hop. It's 1/10 of hip hop.
Yeah.
But even in those things, even in some of the trap songs, which I'm like, what the heck are you saying? It's also, I understand that sometimes these are ways that we numb our pain.
Yeah.
This repetitive beat. I'm from the Caribbean. We use carnival and music to drown our sorrows. Everything is about a girl winding up. Everything is about rum but we have to think, what is happening in our community? What is happening in our society that this form where we are trying to escape this pain, the mental dis-ease that is occurring? It is traumatizing knowing that when you go into a store, just because you need a t-shirt, you're going to be followed.
Yeah.
It's traumatizing to know that when you walk down the street, you have more likelihood to be stopped by a police officer. It is traumatizing to know that should you have a mental health crisis and you call the police, you are 16 times more likely to be unalived.
I said that in a rap recently. Mental health is a card the melanated can't play. You know what I'm saying? And
Right.
you know, I often say that. I mean, I'm a paraphrase Audre Lorde very badly, but the very act of telling, if you're part of an oppressed community, the act of telling your story is resistance, right? She didn't say it had to be a really dope, positive, rosy story. And like, you know, somebody said earlier, like, I can't support rap that has the B word and the N word in it. When I go down to 3rd and Palouse and I go holler at my cousins, I'm not code switching. You know what I'm saying? And my next album, Critical Race Hip Hop, coming out, I'm very angry, and I do say that. I don't say the B word. That's not my space. Just because I don't want white folks to say, you know, the N word. I'm not a hypocrite, but you know, I do use very colorful language to paint the picture that I intend to paint. And you know, my cousin, he sells illicit products on the corner. He's not rapping about mental health. Like, he's gonna rap about his life. And that is valid, and that's understandable. And you know, a lot of people, they say, well, what about these kids in Chicago? Why they, you know, rapping, selling out their stuff? Yo, if somebody offered me $100,000 to get my mom out of the projects, out of a war zone, I don't know much else that I would do other than try to take that. What are we rapping about? You know what I'm saying? Especially if that's all I know. You know what I'm saying? So I don't fault these kids for what they spit about. They are storytellers. They are griots, and we are not listening. Our body politic is not listening. In fact, we're doing the same thing colonizers have done to our storytellers, talking about the diaspora forever. We are vilifying them. You know what I'm saying? And that's it. So I don't see you know, these kids rapping about this as an issue. What I do see is these 3 corporations elevating this pain, this small percentage of rap that is about this sheer violence, elevating that for the entertainment of white kids. That's a problem. You know what I'm saying? Because when my daughter grows up, I don't want her not to hear WAP. I want her to hear the entirety of female expression within her culture, and she can choose what she like to do. So I'm not here to vilify anything, but I am here to elevate everything in this culture so people can take their pick. And that's just it. We've got to stop thinking of hip hop as this negative thing because white people have invested in it in a certain way. And I'm going to say
very true. And I want to build on what you're talking about, because when we're saying we're talking about culture and people's lived experiences, the expression of hip hop, whether it is through movement, whether it is through visual art, whether it is through storytelling, which is all the different forms of music connected to hip hop, it's an auto-ethnographic approach to research. If we're gonna put all the other stuff aside, and we're gonna bring in the academic lens here for all the folks that need justification, it's an auto-ethnographic approach. And that's an approach to research where the researcher, the hip hop artist, you, the audience, use and connect your lived experiences to the cultural and the social meanings that are happening around you. And so we look at it as qualitative research or arts-based research. And so when you think of this, the albums that people are writing, hopefully they're writing them, but we already know. I know Lil Wayne, just everything's off the top of his head. Like, he's just straight up freestyles. Somebody got to write it down because he don't write nothing.
Yeah.
But what they're writing are research studies, right? So I looked at, different journals, right? So the Journal of American Medicine, there's some research that came out a few years ago, and they were talking about hip hop and lyrics specifically to rap music. And they found that between 1998 and 2000, and I believe 18 or 2019, there was a significant increase in the mentioning of mental health by artists in songs from different genres, right? And it wasn't just looking at America. Clearly, most of the artists are coming from America, but they looked at things in UK, they looked at other things, and it's like, oh, mental health is being mentioned a lot. Suicidality is being mentioned a lot. Depression is being mentioned a lot. Substance abuse is being mentioned a lot. Anxiety is being mentioned a lot. And these were all male identified artists that they looked at. So I want to be clear about that too, because when I think through to, like, for example, Drop the World with Lil Wayne and Eminem, we're talking about the roles and the struggles that male identified people have navigating their own emotions and their experiences against the world that tells them that they don't get to have feelings outside of rage and anger. So when you're conditioned that the only expression of your humanity is but one of the over 3,000 emotions that we have, and you're reduced down to this, how can you have a sense of who you are? When we think about what's happening in places like Brownsville and East New York, in New York, and when you're thinking about what's happening in Chicago and what's happening in the Bay Area, and we're thinking about what's happening around the world, poverty across the world is always the number one driver for crime. We have criminalized poverty. And who is connected more so to poverty in this country? When we think about the experiences that people have navigating the healthcare system, research indicates that people that look like me, Asian American people, South Asian and East Asian, Hispanic people, Black people, when they go to the doctor's office, they feel they have to present themselves better, have to put on a nice suit, have to be quiet, not to push back. But this is also contributing to why that Black women are dying perinatal, postnatal, 3 times more likely than white women, at least in this country, regardless of socioeconomic status. Because the narrative will be, oh, it's because they're poor. No, I am 4 degrees in, God knows how many licenses, and I have a 3 times more likelihood of dying because of navigating the healthcare system. In New York, I see the difference between hospitals that are right next to each other. Hospitals literally where they're sharing medical providers, where you go through one door, and this is for the rich, well-to-do people, and they have 4 nurses for 1 patient. And then the city hospital right next to it, where you can't find a nurse because nurses are being assigned 50 patients. In the same New York City that is progressive. So we also want to challenge these political things that we kind of assume, because it is bigger than politics. This is about who we humanize and who has the privilege and the honor of being seen as a human being with all rights and privileges assigned to them. And the connection to the dis-ease that happens. I don't say disease. It's a dis-ease in our mind. It's a dis-ease in our soul. It's a dis-ease in our body. It's a dis-ease in our community. It's a dis-ease in our family. But those are structural. Those are intentional. Redlining is still real. So when we think about hip hop as a culture, influence and impacting, this is something that came out of the Vietnam War. This is something that came out of the gang and turf wars in New York City and the Bronx. Shout out to New York. This is something that came out of that, right? So when we think about this vulnerability, when we think about the desire for vulnerability, the only avenue these people have been given is hip hop, because that's been acceptable. Because should they say to their friend, I'm hearing voices, I am struggling, toughen up, oh, man up, whatever those things are, because we ourselves as humans do not have the language all the time. How many of you, when someone says, when you ask, how are you doing? And it's good. Will you really listen when someone says, actually, I'm not good. I'm having a really bad day. It's been a really bad year for me. I'm dealing with this, and this. We don't listen for the answer. We listen for what makes us comfortable. Hip hop makes us uncomfortable, because if we listen to the lyrics that are written, the spoken word, because that is also part of hip hop, and the scenes in the spoken word cafes in New York City, and I know you have them in the Bay Area. If you listen to what people are talking about, when they're talking about the wars that are currently happening in this world, when they're talking about the wars in their community, when they're talking about, as a woman, what it is to feel violated, be sexually abused, and to risk your life because you're just trying to go down the street. When they're talking about those things, we have to hear. You mentioned Cardi B and all of these things, right? And I think through, I had to start challenging myself. Cardi B is a brilliant person.
Brilliant.
This woman is a historian. She is amazing. David Letterman did an interview with her years ago, and I was just like, oh my gosh.
Yeah.
But then I think of it. Why, if you are this brilliant historian and you know so much, she's really big on advocacy and policy, to support your family, it's almost as though there's a completely different side that she's engaging or perhaps disassociating with, which is also a mental health disease, to ensure that she can survive because of who's controlling the purse strings. We have to think of those, right? Megan Thee Stallion, Cobra. I don't know if you guys listen to Libis or Cobra, but that is somebody talking about their struggles with mental health and depression. But that's also someone who experienced publicly being shamed for speaking about an incident where they were injured, right? How the violence in our communities against women, the violence in our communities against our trans and LGBTQ siblings. These are the ways and the avenues. So when we think about hip hop, and I'm coming back to you because all that was to come back to you. Can you elaborate and I know we have a few more minutes and we're going to wrap this up. As we wrap up and we set the stage for the next time, can you talk about the importance of shared experience in hip hop resonating across different communities and helping to foster a sense of belonging?
Yeah, I mean, I first want to say, because I'm 41, right? So I'm considered an ancient dinosaur in rapping, like whatever. But you know, as a hip hop historian and educator, I don't have the luxury of not listening to these young kids coming out of Chicago and coming out of wherever. Like, you know, when you were speaking, I thought of XXX Tentacion, that song "Siding on You." You know what I'm saying? He's talking about, if you leave me, I'm going to commit suicide. I'm a suicide on you. He's talking about his whole thing is mental health, and I'm having a hard time. And that dude had a hard time until the day he died. We talk about King Von out of O Block. And mind you, he was a demon, you know what I'm saying? That dude was a murderer. But if you look at one of the songs he got famous for, it was a narrative story akin to Slick Rick or Outkast storytelling about a girl who tried to play him. And he was with her, and she tried to play him, and everybody got killed. You know what I'm saying? Like, these are the stories that are just opening up the ability for a lot of the kids going through the worst of the worst to even start discussing these feelings. You know what I'm saying? And so I want to caution everybody, because I know a lot of the times we look at the industry and we say, oh, these kids are, look what they're rapping about, they're one-dimensional. And then when you actually listen to their whole album, if you can stomach it sometimes, you know what I'm saying, you might find something like, yo, Megan Thee Stallion is not just rapping about her backside, which, go ahead, rap about your backside, baby. That's you. Bodily autonomy is the number one part of like owning your space. But I caution us to listen to the top 40 and then just make judgments off of these folks, because they have so many gems, and that's why they're so big in the Black community, because they're dealing with these topics that kids are struggling with, and they're doing it in an affirmative way. You know, if we go to Glasgow, right? Glasgow has a drill rap scene coming out. Yeah, Glasgow. And that's the poor community in Glasgow that has no hope. They have nothing to do but bang on a wall and rap, you know what I'm saying, and try to feel something. So I think the thing about, you know, hip hop is, you know, hip hop was made by us. It's for everybody. You know what I'm saying? And I think that everybody, especially in this day and age, needs some form of practicing swag, or, you know, practicing their own efficacy, their own self-esteem, right? Their own belief in themselves. And that has to be a repetitive practice that you feel safe in. And I think that's why a lot of people, I mean, hip hop has been taken by everybody. You know, you have some 80-year-old person in the boardroom, they know they rapping, you know, when they get in their car, they might be rapping something. It's like, you're either hip hop cultured or you're hip hop curious. And where we have these shared practices, we have ability to identify with each other across community. And I think that's really important. So when I go throw my drip fest over here, you know, it's a space, and you see the white folks in this space, they don't feel like they're not supposed to be there. You know what I'm saying? Everybody, like, I've never had a fight at my hip hop show. Not one of them. I've been doing this for like 15, 20 years, but you have a show that's about women's empowerment. You have a show that's about environmental justice, you know what I'm saying? And now I'm doing my shows about health and wellness. People are amazed at the ability for us to feel comfortable, to feel safe, and for our cultures to be recognized, and then people don't have to code switch, don't have to hide it. You know what I'm saying? I think that ability to be, I don't even want to say be vulnerable, but it is kind of just being ourselves. Like, oh, you mean I can take this veneer off of whatever I have to show up for society. I can just be me here. Exhale. You know what I'm saying? And that space for me is the nugget of why hip hop is so beneficial in therapy and in public health, because it gets people to be themselves. And if you can't show up as yourself, then what are we talking about? You know, we're not talking about helping you because you can't even be yourself. When I go into these mental health offices and you hear elevator music, you know, and you sanitize white walls, I'm like, how do we make this a comfortable space? You know what I'm saying? And we'll talk about public, you know, hip hop in terms of public health and hip hop in terms of public, in terms of therapeutic practices in the next sessions. But I think that hip hop has been our therapy when we did not have access to it. Period.
Right there, because access is one of the number one issues and challenges that we have. And as we bring it back to Mental Health Awareness Month, access to mental health, particularly for marginalized communities, is a severe problem. Mental health and depression is the leading disability in the world, according to the World Health Organization. We so long have minimized the impact of our mental well-being. We experience the bullying in our jobs. We experience it in our families. We experience it in our communities and societies, and we don't understand how we keep taking those more than 1,000 cuts a day and the impact on our psyche, the impact on the way that we view the world, right? You navigate the world in whatever form or shape you do. I think of people with, this world is not made for people with who don't fit the norm. But what is normal? Do we have a world that is fully accessible? No. Because if we did, we wouldn't have ADA, right? No. It would just be. If we had a world that truly valued humanity, we wouldn't have child marriage. We wouldn't have women and people being raped. We wouldn't have LGBTQ individuals and trans women and trans men being murdered. We wouldn't have any of this. No. We would have equity and access. We would have, as a provider, someone who can understand who we are, celebrate who we are, and also be paid for that. A lot of the therapeutic approaches that we're talking about are not even covered by insurance. No. Who has public insurance in America more so than others? One of the most impactful aspects for me on my therapeutic journey was when I had a 5-year-old who was sexually abused, who had public insurance Medicaid, and a 5-year-old who was sexually abused whose parents had private insurance. That determined the length of treatment I could provide. Both babies, both unspeakable traumas, should never have happened, but that was permitted by regulation and law to determine the length of treatment somebody could have based on parents' ability to pay for the same trauma. And this is compounded. So when we think about using this as a form of resistance and healing, this is literally about shifting, as you said, and reimagining the healthcare ecosystem. As we're winding down, if anybody has a question, you can put it in. We have 4 minutes and we're going to honor time, but we also want to let you know that this today was about framing the why of hip hop, the how of public health, and the who is being helped or healed with this approach and using it as a mental health. Next week, Wednesday, we are going same time next Wednesday. We're going to talk about hip hop as a therapeutic intervention. And we're going to lay the clinical research down for those who need the validation, the White Tower validation. We'll lay that down for you. But there's some amazing people like Dr. Raphael Travis, who is a clinical social worker in Texas and who oversees the MSW program. Shout out, because I'm a social worker. And as we were talking about the people who've been doing this work, a lot of the people that we found are social workers by training. And, you know, there's also Dr. Edgar Tyson, who passed away in 2018, but literally laid the foundation and the theoretical approach for hip hop therapy in the Bronx, Fordham, And so when we're talking about these things, social work is inherently supposed to be anti-racism and anti-oppressive. And so when we have people who are literally in the community working to address these needs, we want to highlight that, because we want to be clear with you that there are therapeutic approaches that are using hip hop. This is not something that is new, but we are looking at how we expand and evolve it to beyond one form of hip hop to every form of hip hop as a therapeutic intervention for community healing, elevation, and growth.
Wow.
How can you connect with us? Our information has been scrolling across. We would love to connect. I know there's also someone, Dr. S, who has Mental Hop, who's based in New Jersey on the East Coast, who does amazing work around mental health and hip hop and teaching people. So there's a lot of people in this space and growing, and there's more highlight of what's happening. And so next week, we're going to really talk about, but social workers. Next week, we're going to talk about hip hop literally as a therapeutic intervention. And week 3, we're going to bring an amazing person, my sister from another, Carol Kim, who is a public health expert, an amazing human being. And we're going to talk about hip hop as a public health intervention. So we want you to make sure that you stay tuned, and we want your questions. We will definitely make sure that if whatever we don't answer today, we're answering the next time. I'm passing it back to you to close this out.
Word. Yo, Big Noise Radio. We are here. I feel like the number one thing is why we're doing this right now is because people need to know we're here. We're here to help. We're here to push this forward. I think we're truly for our people's betterment. And that's important. So anybody who needs this info, just holler at us. We are here to speak. We're here to talk. We're here to help. Yes. Big Noise said he's got a powerful story to tell. What mental health experts can you recommend for our Ubuntu brothers and sisters who only speak French?
So that's very specific, and I don't know off the top of my head because that's not my language, but I'm sure that there are practitioners, but I don't know anyone off the top of my head, and it also will depend on where you are. What I can recommend, however, is if people are in need of mental health professionals that are of the global majority and of linguistically capable, if you have insurance or not, there are some really amazing platforms that you can Google. French-speaking therapist, therapist from whatever. My therapist is from the Middle East, and she speaks Arabic, English, and French, right? So I knew I needed someone of the global majority, and so I think it's really important that you're doing those filters. And I will also say, as an advocate, I myself have gotten on my insurance company and said, when I filter for somebody of the global majority, it takes it from 500 to 20 people. This is a problem. You guys need to diversify your panels, right? And we'll get into that stuff later. So, but I will encourage that you look up that information. And next week, we will, on screen, we will provide some tangible resources for people to look up to explore mental health resources across the country.
There are some states that mandate interpreters if necessary as well. So they'll pay for that if you have certain insurance for that as well. But certain states don't care, and certain states act like they do. So please do your research. But yeah, thank you, Dr. Claire. You're amazing. I really appreciate this first part of this series. It's just wonderful having a discussion with you. And shout out to everybody else who came on board to stick around with us as well.
Absolutely. Thank you so much. I think you're incredible, and I'm truly honored to share space with you and every single person that was commenting and participating. We are you, and we thank you so much for giving us the gift of your time, because time is the only gift you can never get back.
Well. All right, y'all, till next week.
Next week, we're talking about mental health and hip hop as a therapeutic intervention. Stay tuned.
Peace, love, unity. Peace, y'all.